Emergencies can happen anytime, and knowing first aid CPR and how to use an AED can save lives. Whether you're a parent, a teacher, or just someone who wants to be prepared, understanding these life-saving skills is crucial. Let's break down the foundations of first aid, AED, and CPR so you can act confidently in a crisis. Emergencies can strike without warning, whether at home, work, or in public places. Knowing how to respond effectively in such situations can mean the difference between life and death. Whether dealing with sudden cardiac arrest, severe bleeding, burns, fractures, choking, or allergic reactions, having the knowledge and confidence to act swiftly is crucial. First aid, automated external defibrillators (AEDs), and cardiopulmonary resuscitation (CPR) are three fundamental life-saving techniques that everyone should learn. These skills are not limited to medical professionals. They are essential for parents, teachers, office workers, and anyone who may encounter a medical emergency in their daily lives. Understanding and applying first aid ensures that injuries do not escalate before professional medical assistance arrives. Properly using an AED can help restart a person's heart during cardiac arrest, significantly increasing their chances of survival. CPR, on the other hand, maintains blood circulation and oxygen flow to vital organs, buying crucial time until emergency responders arrive. These three techniques work together to create a strong foundation for effective emergency response, helping to save lives and reduce the severity of medical crises. Importance of first aid. First aid is the immediate care given to a person suffering from an injury or medical emergency. It is the first line of defense before professional medical help arrives and plays a critical role in stabilizing the patient, relieving pain, and preventing the condition from worsening. First aid is particularly useful in cases of wounds, fractures, burns, choking, and allergic reactions, where immediate intervention can prevent complications. For instance, controlling bleeding early on can prevent excessive blood loss, and correctly managing a burn can reduce the risk of infection and scarring. Knowing how to immobilize a fracture properly can help prevent further injury. First aid is also essential in cases of cardiac arrest, where quick and decisive action can mean the difference between life and death. Beyond physical benefits, first aid training also provides psychological reassurance. People who are trained in first aid tend to be calmer and more confident during emergencies, which can positively impact the victim and those around them. Many workplaces, schools, and public areas require employees and staff to undergo first aid training. Certification programs are commonly held in offices, schools, community centers, and even online, ensuring that more people are equipped to handle emergency situations. The more individuals trained in first aid, the safer communities become. Understanding AEDs and their role. An automated external defibrillator (AED) is a portable device that can deliver an electric shock to restore a normal heart rhythm in someone experiencing sudden cardiac arrest. AEDs are designed to be user-friendly and provide voice-guided instructions, making them accessible even to individuals with no medical background. Cardiac arrest occurs when the heart suddenly stops beating due to an electrical malfunction. Without immediate intervention, brain damage and death can occur within minutes. AEDs are crucial in these situations because they can deliver a controlled electric shock that helps the heart resume its normal rhythm. The quicker an AED is used after cardiac arrest, the higher the chances of survival. AEDs are typically placed in high-traffic areas such as airports, shopping malls, schools, gyms, stadiums, and public transportation hubs. Their presence ensures that bystanders can take action immediately rather than waiting for paramedics to arrive. In many cases, emergency response times can be longer than the window of opportunity needed to save a life, making AEDs a critical component of public safety. Knowing how to use an AED is a valuable skill that can empower people to act confidently in life-threatening situations. Many first aid and CPR courses now include AED training, ensuring that more people can assist in cardiac emergencies. Public awareness campaigns and workplace safety initiatives continue to promote the importance of AEDs, helping to increase survival rates in cardiac emergencies worldwide. The life-saving power of CPR. Cardiopulmonary resuscitation (CPR) is a critical technique used to keep blood and oxygen circulating when the heart has stopped beating. It involves a combination of chest compressions and rescue breaths, although hands-only CPR, which focuses solely on chest compressions, is also an effective method. CPR can be the deciding factor between life and death in cases of drowning, suffocation, heart attacks, and drug overdoses. CPR is vital because when the heart stops, the brain and other vital organs quickly begin to suffer from a lack of oxygen. Without CPR, permanent brain damage or death can occur within just a few minutes. By performing chest compressions at a rate of 100 to 120 per minute, CPR helps keep the heart pumping blood, providing oxygen to the brain, and increasing the chances of survival. Proper CPR technique is crucial to its effectiveness. Chest compressions should be performed with enough force to push at least 2 inches deep into the chest, allowing the heart to refill with blood between compressions. Rescue breaths help deliver oxygen to the lungs, but in situations where mouth-to-mouth contact is not possible, hands-only CPR is a viable alternative. CPR training is widely available through community programs, hospitals, and online courses. Many organizations encourage workplace CPR training to ensure that employees are prepared to respond in case of an emergency. Schools are also beginning to introduce CPR training into their curricula, ensuring that younger generations grow up with the knowledge and confidence to act in emergency situations. The history and evolution of first aid. First aid has a long history, dating back to ancient civilizations where medical knowledge was rudimentary yet essential for survival. Ancient Egyptians, Greeks, and Romans developed early forms of first aid to treat battlefield injuries and everyday accidents. Herbs, bandages, and basic surgical techniques were commonly used to stop bleeding and promote healing. The modern concept of first aid emerged in the 19th century with the establishment of organizations like the Red Cross and Street John Ambulance. These organizations created structured first aid programs to train the public in life-saving skills, making emergency care more accessible. Over time, advancements in medical science and technology have improved first aid techniques, leading to more effective treatments and better survival rates. Today, first aid training is more accessible than ever, thanks to technology. Online courses, mobile apps, and virtual reality simulations allow individuals to learn life-saving skills at their convenience. Automated external defibrillators, AEDs, and modern CPR techniques have further improved the effectiveness of emergency response. As research continues, new methods and tools will likely emerge, making first aid even more efficient in saving lives. Assessing an emergency situation. Before administering first aid, it is crucial to assess the emergency scene to ensure safety. If an accident occurs in a hazardous environment, such as a burning building, flooded area, or near electrical wires, rescuers must prioritize their own safety before assisting others. Acting without caution could lead to further injuries or endanger more lives. Once the scene is secure, the next step is to assess the victim's condition. Checking responsiveness and breathing is essential in determining the appropriate course of action. If the person is unconscious but breathing, they should be placed in the recovery position to keep their airway open. If they are not breathing, CPR should be initiated immediately. Calling emergency services should always be a priority, even if first aid is administered. Professional medical assistance is necessary to ensure that the patient receives proper treatment. If there are bystanders available, delegating tasks, such as calling 911, retrieving an AED, or providing assistance, can improve response efficiency. Training in first aid also teaches individuals how to recognize the signs of medical conditions like heart attacks, strokes, and severe allergic reactions. Knowing the symptoms and acting quickly can prevent further complications and improve survival outcomes. Emergencies can be overwhelming, but being prepared with first aid knowledge ensures that individuals can act with confidence and make a positive difference in critical situations. By understanding how to assess emergencies, provide CPR, use AEDs, and administer first aid, people can contribute to a safer and more prepared society. Managing severe bleeding and wounds. Severe bleeding is one of the most urgent medical emergencies, as a person can lose a significant amount of blood within minutes, leading to shock or even death if not treated promptly. The first step in managing bleeding is to apply direct pressure to the wound using a clean cloth, bandage, or even a piece of clothing if necessary. Firm and continuous pressure helps to slow blood loss and allows the body's natural clotting mechanisms to take effect. If possible, elevating the injured limb above the heart can further slow the bleeding by reducing blood flow to the affected area. However, if the wound is on the head, neck, or torso, elevation may not be possible, and applying direct pressure remains the best course of action. Proper wound care extends beyond just stopping the bleeding. Cleaning the wound with clean water or an antiseptic solution can help prevent infection. Once cleaned, applying antibiotic ointment and covering the wound with a sterile bandage can promote healing and protect against dirt and bacteria. For deep wounds, puncture wounds, or those caused by animal bites, medical attention should be sought immediately, as these injuries carry a higher risk of infection and complications. Treating burns and thermal injuries. Burn injuries can range from minor skin damage to life-threatening conditions, depending on the severity and extent of the burn. Burns are classified into 3 categories based on their severity. First-degree burns are the mildest and only affect the outer layer of the skin. They typically cause redness, pain, and mild swelling, but do not blister. These burns can be treated at home by running cool water over the affected area for 10 to 15 minutes. Applying aloe vera gel or a burn ointment can also help soothe pain and reduce inflammation. Third-degree burns are the most severe and involve the destruction of multiple layers of skin and underlying tissues. These burns often appear charred, white, or leathery, and they may not be painful initially due to nerve damage. Immediate medical attention is required for third-degree burns. While waiting for emergency services, covering the burn with a sterile, non-stick dressing and keeping the victim warm can help stabilize their condition. It is important not to apply ice, ointments, or butter to severe burns, as these can worsen the damage. Chemical burns and electrical burns also require special care. In the case of a chemical burn, rinsing the affected area with copious amounts of water is the first step, but it is crucial to remove any contaminated clothing to prevent further exposure. Electrical burns, on the other hand, can cause internal injuries that may not be immediately visible, making it essential to seek medical attention even if the skin appears relatively unscathed. Conclusion: the life-saving importance of first aid, AED, and CPR. First aid, AEDs, and CPR are not just skills for medical professionals. They are essential tools that can empower anyone to respond effectively in emergencies. The ability to manage bleeding, treat burns, handle fractures, and assist choking victims can make a crucial difference in life-threatening situations. Learning these skills is not difficult, but it requires proper training and practice. Many organizations, such as the Red Cross and the American Heart Association, offer certified courses in first aid, CPR, and AED usage. Taking these courses can provide individuals with the confidence and knowledge needed to take action in an emergency rather than feeling helpless. Public awareness and accessibility to first aid resources also play a key role in improving survival rates. Placing AEDs in public spaces, encouraging CPR training in schools, and integrating first aid education into workplace safety programs can create more prepared communities. By fostering a culture of emergency preparedness, lives can be saved and injuries can be prevented from becoming fatal. Emergencies are unpredictable, but preparation is within everyone's reach. Investing time in first aid training is an investment in safety. not just for oneself, but for family, friends, coworkers, and the wider community. When more people are equipped with these life-saving skills, the chances of survival and recovery in medical emergencies increase dramatically. Being prepared with first aid, CPR, and AED training can make all the difference when it matters most. Take the time to learn these skills and be ready to save a life. If you found this helpful, don't forget to like, subscribe, and share for more essential safety tips.